My name's John Chester. I'm the Cancer Research UK Professor of Medical Oncology at Cardiff University and an Honorary Consultant in Medical Oncology at the Velindre Cancer Centre in Cardiff. I'm an academic clinician, so my work involves both clinical medicine, seeing patients, treating patients, and also research. So I've got an ideal combination of looking after patients in the present and also those in the future. The single most challenging thing about doing research in the NHS is combining the different elements of things, the caring for people in the here and now, and also thinking ahead in terms of research. So it's sometimes difficult to get a balance between having to rush off to clinic or the wards, spending time with people when they need it, but then also spending the large amounts of time it takes to do top quality research.
My name is Keval Patel, and at the moment I'm a PhD student working with the Rosenfeld Lab in CRUK CI, but I'm also a clinical academic trainee, so yeah. So what do I enjoy about research is that it has the potential to affect a large scale of people, much more than I could come across in my clinical practice. And there are also questions that are based on my clinical practice that need answering to help people in a better way than we can at the moment. At the moment, I spend most of my time in the week doing research, but as I get more and more up the training ladder, I'd be expected to spend an even sort of 50-50 sort of time between clinical and research work. So the single most challenging thing that I find about doing research in the NHS is actually getting the time off when I wasn't funded to do full-time research. Getting the time off to think about things and sit down for a while without the clinical workload bearing on your thinking processes.
I'm Ruth Plummer. I'm Professor of Experimental Cancer Medicine at Newcastle University, but also the lead for the Newcastle CRUK Centre and Newcastle ECMC. I'm not sure I have an ordinary day in my job, but on an average day I see patients either on the clinical trials unit or in my trials recruitment clinics in the morning and spend a lot of my afternoons in doing trial related admin or in meetings talking about developing new clinical research protocols. My whole job is very focused towards research. I do see and treat patients on a regular basis and have some NHS service work treating skin cancer, but the majority of the patients I see and treat do go on clinical trials. And I love the research element of my job because it's always working things out, there's always something new, but also that interaction and the partnership with patients that we have when we talk to them about particularly early phase trials as a difficult period in their lives, and the fact that they want to do this despite all the other things they're facing, I think is the most, inspiring part of the job, the research job that I do. The most challenging thing about doing research in the NHS is finding the time. I'm lucky because I'm an academic researcher and I have more of my time protected for my research clinics, but doing research and talking to patients about research takes longer than an average clinical meeting, and there's additional paperwork to be done. And yes, the challenging thing is that paperwork and the additional time that's needed.
I'm Andrew Hamby. I'm Professor of Breast Cancer Pathology at the University of Leeds. And I'm also an honorary consultant for the NHS at Leeds Teaching Hospitals NHS Trust. And in fact, the NHS part of my job takes up a greater proportion of my time and my contracted hours. No day or week is exactly like another. However, there are some fixed points, and these largely revolve around my NHS duties. And between these NHS duties, I fit in my research duties when I can. I try and fit in what research work I can, and not only would this include dealing with my own research, so that might be having supervision meetings with PhD and MD students, research meetings at which we talk about the projects that we've got currently going and which direction they may go in, but also it will involve acting, if you like, in a service function for other researchers here in Leeds and other Cancer Research UK researchers who don't have the pathology skill sets that we have. So there is a necessity for us, for example, to correctly assign a tissue compartment and relate it to a particular antibody stain or molecular marker. So as well as our NHS service duties, there is an element of university and academic service work in addition to our own research. Doctors are paid in units called PAs, which are approximately 4 hours, and I'm on a 12 PA contract. And of those, in theory, 7.5 are devoted to the NHS. So the greater part of me that is contracted is there to do NHS service delivery. And then the rest of the time is there for me to either service research or undertake research of my own. So it is possible, and sometimes the case, that NHS duties will invariably eat into research time. And some of that time I can make up in my own time, and clearly nowadays we're able to do quite a lot online, so there are things I can do at home as well. As a histopathologist, I think I'm at the front line of translational research. So what I do in my day job directly marries across with what I do in my research. So for example, when we're looking down the microscope, we see a diverse range of appearances of tumours. And one of my research interests has been in the heterogeneity of breast cancer, and the fact that when tumours look different, underlying that there's a different molecular profile. The single most challenging thing about doing research in the NHS, I'm a university employee, but actually the greater part of my funding, my time is, if you like, owned by the NHS. Both have expectations of me, and both only see a part of me at any one time. So there's always this concern that for any single employer you may appear like you're slacking compared with your peers. And so in general, my impression is that a lot of academics try and overperform in order to try and justify their existence in both worlds. And we end up doing at least 2 full-time jobs because of this. And sometimes it's more. We, as well as working for the university and the NHS, we often have funders who we feel we owe something to, and rightly so. For example, Cancer Research UK, or in my case also Breast Cancer Campaign, for which I do a lot of tissue banking. And so we have commitments there also. So we can end up in some weeks answering to many different employers. And so that is a challenge. And there's also this feeling, and particularly also in the mix I should throw in, we have a lot of junior researchers, junior pathologists around the place who want a piece of you, which is great, and it's fantastic to deliver education and support to these people. But each one of them, you feel you may not be giving your all. And then of course what they actually are seeing is a bit like an iceberg viewed from different angles. So they might just see a little bit of you as a pointy bit above the water. But in reality, there's a lot more of you doing a load of other stuff, which is perceived by other people at different angles as only a little bit. But all those little bits add up to quite a lot. And that's the challenge, trying to please all of the people all of the time and also get job satisfaction. But it's also a challenge which is quite fun to try and meet.